Hi everyone, I am Kritzel Castillo and I will be sharing to you depression and its overview. The contents of my presentation includes objectives, definition, difference between depression and sadness, causes of depression, statistics, risk factors, diagnosis, treatment, and prevention. Here are the objectives of my presentation: to be able to distinguish depression from sadness, to know the signs and symptoms of depression, to learn the risk factors and treatment of depression, and to understand depression itself. But before everything else, what is depression? Depression is a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Fortunately, it is also treatable. It is classified as mood disorder. It can lead to a variety of emotional and physical problems and can decrease a person's ability to function at work and at home. Sometimes we mistakenly consider depression from sadness. But don't you worry, we will know their differences as we get along. Ask yourself this question: am I depressed or just sad? It's important to realize that feeling down at times is normal part of life. Sad and upsetting events happen to everyone, anywhere, anytime. But if you're feeling miserable or hopeless on a regular basis, you could be dealing with depression. So now, let's learn their differences. Depression versus sadness. Let us decipher their differences. Let's start with depression. Mental illness. As by definition, it is a mood disorder. It is a serious medical illness and it is treatable. Mood is decreased for weeks. A depressed individual is usually observed losing its interest on things that he or she once enjoyed, or the individual becomes irritable all the times. Feeling of worthlessness is pretty much observable. A set of instances that would likely generate depression are losing a job, being a victim of physical assault, low or failing grades, or a major disaster. When things seem to turn upside down, depression is likely to happen. Now, let's go to sadness. Simply, sadness is an emotion. It is a normal feeling. Every individual can be sad. So if you're sad, don't you worry. It's normal. When we say painful feelings come in waves, it means that sadness come and go. Like for example, at this moment you are sad, but later you will find yourself smiling. Self-esteem is usually maintained. The confidence and trust of a person in thyself is not broken, yet it is maintained. Just for instance, a person is sad because he cannot attend to his friend's party, then it does not concern with losing its self-esteem. Maybe you are wondering why people get depressed. Now, let me present the causes of depression. Family history. You are at a higher risk for developing depression if you have a family history of depression or another mood disorder. We can say that depression is an inherited illness. Early childhood trauma. Some events impact the way that body reacts to fear and stressful situations. Like for example, a child was harassed by its own parents. Brain structure. There is a greater risk for depression if the frontal lobe of your brain is less active. Medical conditions. Certain conditions may put you at higher risk, such as chronic illness, insomnia, chronic pain, or attention deficit hyperactivity disorder or ADHD. Drug use. A history of drug or alcohol misuse can impact your risk. In addition to that, there are also causes of depression that includes stressful events such as loss of a loved one, economic problem, or a divorce. To get to know if you have the signs and symptoms of depression, here's a couple of things you should observe. Loss of interest. The person doesn't seem to find joy in the activities that he or she once enjoyed. The thing that the person loved no longer excites him or her. Changes in appetite. Eating may also be affected when a person is suffering from depression. Picking foods resulting to weight loss is also observable. Sleeping pattern is also affected if a person is depressed. Tendency is that the person might sleep too much because he wanted to escape his or her thoughts, or the person cannot sleep because he cannot stop his or her mind from wandering. Another signs and symptoms to be observed are increased fatigue. A depressed person's body is weakened. This is due to the compiling stressful events. A depressed individual is observed to be moving slow or talking slow. This may be the result of body's low energy. Depressed individuals suppress themselves in engaging into physical activities. Feeling of worthlessness is one of the major signs if an individual is going through depression. Self-worth is not observable to a depressed individual. They always think and feel that the world is better without them, which is not true. Remember, every being has a purpose. Another signs and symptoms are difficulty in making decisions. A depressed person has a really messy mind. His or her ability to decide is declined due to the situation that he or she cannot think straight. Depressed mood. The mood where a person is sad on a regular basis. No energy, no activity, no appetite. This will result to a depressed mood. Suicide. Suicide is lying on the back of a depressed individual's mind. Thoughts like this is very crucial and needs immediate attention and medical care. Who suffers from depression? Women are twice as likely to suffer from depression than men. Women may be at higher risk of suffering depression partly due to hormonal changes brought on by puberty, menstruation, menopause, and pregnancy. Although women are more likely to suffer from depression, men are more likely to commit suicide. This may be because men are more reluctant to seek help for depression. Men are more likely to use alcohol or substance abuse to cover their condition. Children. The rate of mental health condition tends to increase in adolescence. This is the experimental age. Teenagers are more likely to go on adventures. Elderly. Older people may lose loved ones and have to adjust in living alone. They may be physically ill and unable to become as active as they once were. Depression affects an estimated 1 in 15 adults or 6.7% in any given year. 8.1% women are greatly affected by depression than that 4.6% of men. For 18 to 25 years old, which is the most susceptible age, the prevalence rate of depression is 8.7%. For 26 to 49 years old, it is 7.4%, and for 50 years old onwards, it is 4.5% prevalence rate. The risk factors of depression includes biochemistry. We all know that chemical reactions in our body have their important role that keeps us alive. Certain differences in the chemicals of our body, especially to the brain, can lead to depression. Depression can run in families. This mental illness is inherited. For example, if one identical twin has depression, the other has a 70% chance of having the illness sometime in life. Another risk factors that could greatly contribute at developing depression are personality. A person with low self-esteem who is easily overwhelmed by stress or who is generally pessimistic appear to be more likely to experience depression. And of course, environmental factors. Exposure to unhealthy environments such as violence or poverty contributes to mental trauma, which then triggers the development of depression. If you have the signs and symptoms of depression in yourself, don't panic. It is the diagnosis of a health professional who can verify if your symptoms are indicating depression or other illness. It is a health professional that should conduct a thorough diagnostic evaluation, including interview and possibly a physical examination. In some cases, a blood test might be done to make sure the depression is not due to medical condition like a thyroid problem. The evaluation is to identify specific symptoms, medical and family history, cultural factors, and environmental factors to arrive at a diagnosis and plan a course of action. Treatment for depression. Medication. Brain chemistry may contribute to an individual's depression and may factor into their treatment. For this reason, antidepressants might be prescribed to help modify one's brain chemistry. These medications are not sedatives, uppers, or tranquilizers. They are not habit-forming. Antidepressants may produce some improvement within the first week or two of use. Next, we have psychotherapy, also known as talk therapy. It is sometimes used alone for treatment of mild depression. For moderate to severe depression, psychotherapy is often used along with antidepressant medications. Cognitive behavioral therapy, or CBT, has been found to be effective in treating depression. CBT is a form of therapy focused on the present and problem solving. CBT helps a person to recognize distorted thinking and change of behaviors. Significant improvement can be made in 10 to 15 sessions. Another type of treatment is electroconvulsive therapy, or ECT. It is a medical treatment most commonly used for patients with severe major depression or bipolar disorder who have not responded to other treatments. It also involves a brief electrical stimulation of the brain while the patient is under anesthesia. A patient typically receives ECT 2 to 3 times a week for a total of 6 to 12 treatments. There are a number of things people can do to help reduce the symptoms of depression. For many people, regular exercise helps create positive feeling and improve mood. Getting enough quality sleep on a regular basis, eating a healthy diet, and avoiding alcohol can also help reduce symptoms of depression. Depression is a real illness, and help is available. With proper diagnosis and treatment, the vast majority of people with depression will overcome it. Depression is not a joke. Stigma is still rampant. As human as we are, let us all be sensitive. Let us open our ears to those individuals who are loudly screaming inside their heads. Spread positivity so that we can keep our minds healthy. Hashtag mental health. Hashtag spread positivity. Hashtag malinawong hunahuna para sa tanan.